So we continue with our talk about cognitive behavioral therapy for addiction. As I mentioned, like every session, we will cover cognitive behavioral therapy for different diseases. So sometimes an anxiety, OCD, depression, addiction, PTSD, different problems. And every time I do some CBT for a certain problem, I will talk a little bit about the problem, like symptoms, ways of treatment, stuff like that. So for addiction, there is two approaches to treat addiction. There is abstinence-based approach and harm reduction approach. And sometimes we combine both. So sometimes we start with harm reduction at the beginning, then we advise or recommend abstinence, complete abstinence. So abstinence means you stop, you quit 100%. Harm reduction means we're just trying to reduce the harm or reduce the amount of drug use or behavioral addiction. For example, if someone using heroin and inject heroin, we can, and he doesn't want to stop opioid, we can switch to opioid replacement with methadone, which is another opioid, but the patient will get it under supervision with a prescription. So we avoid the risk of overdose. So we are reducing the harm by doing this approach. Another example, someone is injecting heroin and he doesn't want to stop injecting or use needles, and he doesn't want to stop even heroin. So we can offer them needles. So by this, we are reducing the harm, because if they use dirty needle or share it with others, there is a huge risk transmitting different diseases like HIV and hepatitis C and B and all this stuff. But usually the main goal for addiction treatment is abstinence. And again, we use, so someone is addicted to food, for example. Okay, he doesn't want to eat healthy. He want to continue with the eating habits. We try as much as we can reduce the harm. Maybe choose certain days that he eat junk food and certain days that he gonna eat healthy, like work around it. But the addictive behavior will continue, but we're trying to reduce the risk. Another thing in treatment of addiction, I believe in the chronic care model. Chronic care model means you will need care for the rest of your life. What does it mean? So usually in treatment of addiction, we start with detox. I'm talking about like drug addiction. So for certain drugs, you need medical supervision for a week or 2 weeks. Like for example, alcohol. If you're drinking a huge amount of alcohol, you can't quit at home because there is a serious problem can happen, and the withdrawal can kill you. It can cause seizures. It can cause problems. And also sometimes the seizures or the withdrawal is very painful, cause muscle pain, cause diarrhea, abdominal pain. So you go into certain places in Calgary, for example, Renfrew, you go to Renfrew Center, they give you some medication to alleviate the symptom of withdrawal. Then after you finish 1 or 2 weeks, you go into rehab. Rehab means rehabilitation. So you're gonna stay in a place for 1 to 2 months, depending on the availability and the coverage. In this place, it is a controlled environment, so you are not exposed to any triggers. Because when you quit, the first 3 months are the most difficult. 3 months, anything could be a trigger. People, places, things, even watching TV, like lots of, anything could be triggering for relapse. So you stay in a certain place, we control the environment, and also you learn some skills about recovery. Then after you finish this and this, there is continuing care, which you're going to see your doctor regularly, or you're going to attend a group regularly, or AA meeting. And this is a recovering patient. Even if you abstain and you quit, you're still a recovering patient, because for years, you're going to be a recovering patient, because you will need a continuation of care. For people who have addiction to like addictive behaviors like food, relationship, gambling. Lots of them, they don't need the detox and they don't need the rehab. They might need just a continuation of care through therapy and doctors and counseling and the groups. And again, any patient who is not in some form of treatment, like after you finish these two, if you're not in any form of treatment, there is a greater risk of relapse. Okay, that's why you run these groups. Okay, because it's gonna help people to maintain recovery and sobriety. Another thing we wanna share about the addiction disease is what does it mean recovery? Because again, some people believe, okay, recovery or sobriety is just ability to abstain from the drug. No, recovery is not just quitting. It is a process of sustained action, like ongoing action, that's gonna address these disturbances or problem, biological, psychological, social, and spiritual. Because any addictive behavior or addictive drug gonna cause biological problem, like physical problems, psychological problems, social problems, spiritual disconnection. So you'll need to fix these problems. Okay, and also one of the goals for recovery is to improve the quality of life by improving this area, not just fixing problems in your body, but improving. So let's say you got hepatitis or HIV or abscess from injecting heroin or problem, physical problem. You're going to take antibiotic, you're going to do surgery, you're going to take antiviral, whatever is the treatment. So we fix it now, the physical problems that happen because of addiction, but we want to improve the biology and physical body by exercise, diet, sleep, all these positive or wellness changes. The same thing with psychological, like mental health, social, and spiritual. Okay, so this is all is recovery. Also, part of recovery is consistent pursuit of abstinence. So even if you are doing, let's say you are addicted to alcohol, we switch it to you stop the alcohol, but you replace the alcohol with marijuana, and marijuana is a safer option for addiction. Comparing it to side effects or complications that happen from addiction to alcohol. So we can use this as a harm reduction approach, but still in the back of your head, you need to have a consistent pursuit of complete abstinence of addictive drugs and addictive behavior. You need also in recovery to address craving. And by the way, I'm not just talking about alcohol and drugs, food, even like gambling, relationship addiction, pornography, you need to address all this area when you're treating any addictive behavior. The craving, what you're going to do with the craving when you have a craving, what you're going to do with the relationship problem, because lots of people relapse because relationships, what you're going to do with mood swings and emotional problems and addiction or anxiety or anger. So again, and when we say someone is super, this means he's working in his recovery and he working on abstinence. Okay, so this is basically some important point in addiction. Anyway, for the exercise today, we're going to talk about early warning signs of relapse. And again, these signs of relapse. So if you have addiction for food and then you're doing well and you're going to relapse, relapse is a process. There are signs at the beginning. It doesn't happen like suddenly. There is sometimes very subtle symptoms or signs, but it is still a process. Okay, and when you are able to identify the warning signs, you can prevent that process from continuing to its completion. So we will learn today what are the warning signs, and the goal of this exercise to identify your own warning sign of relapse. You can share with us what kind of addiction you are struggling with and what are the warning signs. If you don't want to share what addiction problem you have, but you want to share with us what are the warning signs, you can also share just the warning signs. Anyway, the warning signs usually is a change in thinking, a change in attitude, a change in behaviors, a change in relationships to others, or how you relate to others, changes in the feelings and mood. These are so again, change in feeling and mood, change in behavior, change in relation, relating to others, change in attitudes and thinking. I'm going to give some examples for these early signs. For example, people who have changes in their thinking that can be a sign for relapse is when they started to believe, you know what, they persuade themselves that I can be a controlled drinker or a controlled drug user. Okay, and it can work. So you'll see lots of people who are abstain from alcohol for a year. Then they start to think, oh, I'm good now. I can socially drink. I'll be fine. And then one drink will become 1,000. So relapse can start with thinking. It changes. Also fantasize and remember the good times when you were drinking. This also could be recall some of the positive memories of addiction. Start thinking about addictive behavior or action as a reward or a way to celebrate. We try to look at addiction as a negative behavior, but some people, you know, their thinking change and they look at it as a reward or a way of celebration. Okay. Also change negative thinking is that you give up on yourself and you can't succeed in recovery. Those are early signs of relapse. So no wonder if you have these kind of thoughts, after a month of thinking this way, you're going to relapse. Okay. Also change in attitude, apathy, negativity, selfishness, you know, you believing or feeling that addiction, or sobriety is undeserved punishment. So these changes in the attitude can be a sign or early sign or warning sign of relapse. Also change in how you relate to others, dishonesty, secretiveness, manipulation, self-isolation, being demanding and resentful. You know, so these are some of the negative, you know, changes that happen when you relate to others. Manipulation, isolation, dishonesty, secretiveness, being demanding and resentful. Another changes that happen in behaviors is it changes, especially the routine. You start to neglect your health. You eat unhealthy food. You don't care about the sleep hygiene, and you have irregular sleep habits, impulsivity, loss of self-control. You indulge in very high-risk behavior. For example, you have alcohol problems, and then you go on weekend, you go to a bar with friends, and you say, oh, yeah, I'll continue with abstinence, but I'll just hang out with friends. This is a very risky behavior. Also, procrastination could be a negative behavior that is early sign of relapse. Last one is a change in feeling. You know, any negative feeling could be a trigger and could be a sign for relapse. Whatever, anxiety, anger, irritability, depression, hopelessness, indifference, self-pity, anger, self-centeredness, these are all negative feeling that can happen before relapse. Okay, so the exercise today is you're gonna tell me what are the changes or the warning signs that you see in yourself. You can talk about yourself or others. If you don't have addiction problem, you can talk about if your parent were addict, or if you had a partner who is addict. You can tell us, because sometimes it's easy to see it in people. It's very difficult to see in yourself these things. But if you know someone who have addiction, it's easy to identify these Like for me as a therapist, I know I can tell who is going to relapse soon and who's not based on, these signs and symptoms. So again, I want you to tell me what are the warning signs that you can see in you if you have addiction problem or in others. So again, it's going to be some changes in the way you think about yourself and addiction in general. Like remember the good times, believing that you can be a social drinker or a controlled drinker, negative attitudes like apathy, negativity, selfishness. It changes in how you relate to others, like manipulate others or isolate or shut down or dishonesty or demanding or resentful, change in behavior, stop going to the gym, irregular eating, irregular sleep habit, neglect health, stop seeing your counselor, put yourself in high-risk behavior, procrastination. These are all negative behaviors. Okay, so I'll give you 5 minutes to think about also, the feeling. The negative feeling usually is a trigger for relapse. By the way, when you have a list, you tell me, oh, the warning signs for me is 1, 2, 3, 4. I would suggest, if you are working in recovery, is to keep the list and, have a quick look, maybe put it beside your screen if you work on a laptop or on your fridge or something, and have a quick look every now and then to see this warning signs and ask yourself if you have any of them or not, so you can identify them and start working better on your recovery. I'll give you a few minutes, then we will start the discussion. Thank you.